Welcome to Ask the Expert North Texas here on News Radio 1080 KRLD. Thanks so much for staying with us. I'm David Rankin.
And I'm Kristen Diaz. So there's been a really interesting study that has been circulating. It basically shows that there's been an increase in heart attacks in adults between the ages of 25 and 44, and it's being linked to COVID-19. On today's Ask the Expert, we have Dr. Fahmi Farah, who is the head of Bentley Health, and joins us to talk a little bit more about this study. Is this to you surprising at all?
Yes and no. The age part, yes, because, when we think of heart attack, we typically speaking think of someone who has lots of risk factors, someone who's usually above the age of 40, typically actually above the age of 50. But since COVID, and especially this new study that came out conducted by Cedars-Sinai, showed us that that's not at all the case. In fact, the age group, which is the youngest population, 25 to 44, their risk of heart attack, the rate has gone up by 30% in the last 3 years during the pandemic, which is remarkable.
But is it strictly COVID-based, or is this also lifestyle factor-based?
I personally think that it's multifactorial. The study specifically looked at COVID, the virus itself. So I do believe that there is such a thing. The virus is increasing heart disease. But I agree with you. I think that it could be related to a lot.
There she is. Lost your signal. Okay, so throwing in that there are more factors than just COVID.
I do believe so. The study itself looked particularly at COVID, the virus itself, but I think that it goes beyond that. During COVID, the pandemic, people's lifestyle really changed, especially during the quarantine. They stopped going to the gym, so they're not exercising as routinely. Healthy eating kind of took a toll as well. People were not going to the grocery store as much as possible, so they were trying to buy things that would last longer, which means more preservative in those foods. So just, drinking kind of went up drinking rate because people are working from home. So I think it's more than just one thing, but overall, we do know that the virus itself is affecting the heart. I will mention one other thing in that's related to this. There was another study done that was a few months ago last year that came out. It was done by the VA, and they looked at millions of patients infected with COVID, and they looked at particularly heart conditions, and they saw that over a number of 20 different heart conditions as a result of COVID, there was an increase in all 20 heart conditions across all age groups. So this study kind of reiterates that same thing.
Now, it's also kind of difficult to tell if you could possibly, somebody listening to this could be affected by this when a lot of people who got COVID were asymptomatic. Some people didn't even know they had COVID. I mean, how do we deal with something like that?
That is the tricky part. You're absolutely correct. There are some, especially young people, who are not very sick with COVID. Some of them were very asymptomatic, and we saw it even in athletes earlier on. There were some professional athletes that didn't really have much symptoms with COVID, but then they actually had serious heart conditions, and some of them collapsed during their sports, and we had some fatalities as well. So it is tricky. I just think that people have to really pay attention to their bodies and their symptoms. One of the things I would want everybody to pay attention to is stamina. If you're able to do certain things before and suddenly you're not, that needs to be checked.
One thing about this, you brought up professional athletes. In the last few weeks, we saw the story of Damar Hamlin and the situation that he went through with his cardiac arrest on the football field. Does something like that, does a famous person coming down with that, does that make more people be introspective and look, maybe I need to get myself checked?
I hope so. It really was an eye-opening experience watching it on live TV for millions. I hope this was an eye-opening experience, and that they see, Damar Hamlin kind of defies all the odds of heart disease, because he's somebody who would absolutely not expect to have heart condition or any kind of heart problems. He's young, he's fit, He's athletic. He plays professional football. So that's the last person you expect to be affected by a heart condition at such a young age. So that tells you that nobody's immune from heart disease, not young, not old, not anyone in between. So we really have to pay attention to those risk factors and seek care when we feel the need is there.
So we know that lifestyle has a big part of taking care of your heart health. But with now the COVID factor, you say make sure you get checked if you have some stamina issues. What are doctors now doing if somebody comes in and says, look, I'm having this stamina issue or I'm having this type of feeling in my heart now since I've recovered from COVID? What is there for doctors to do?
So if somebody's coming to a primary care doctor and complaining of some of these conditions, as opposed to before the pandemic, now in the pandemic, knowing the statistics that we know in relation to heart disease and COVID, they should have a low threshold to send these patients to a specialist, to a cardiologist, because there are a number of screening tests that we can do to see what's going on with this person's body. There are the scale is wide in terms of what kind of heart disease they can have as a result of COVID. It could be something very trivial, something that's not very serious, to something very serious like heart failure. So that's why it should not be ignored just because of their age, so to speak. I think anybody who's having symptoms in this during pandemic era, it should be taken seriously, and they should be seeking help from an actual specialist.
How often is it that you go in for something else? When we're talking about COVID, you're talking about perhaps lung issues, and then you go through a scan of some kind, and the doctor says, oh, by the way, I've discovered this heart defect that you might not have never known about and probably wouldn't have if you hadn't come down with COVID.
I'm afraid it happens often, actually. I hate to say this, but I think it does. I think a lot of times people are not able to recognize that it is heart at the bottom, underlying condition is heart. Because you're right, COVID is affecting many other things like the lungs, for example, and sometimes heart gets overshadowed by these other things. I'll give you one example. I have a very young patient in my clinic, one of many, but he's actually a teenager. And he was very symptomatic after his COVID. He never got hospitalized or anything. He was taken care of at home. But then as he recovered from COVID, he started having all sorts of problems, and he went to like 3 or 4 different emergency departments, and they kept discharging him saying, everything's fine, you're young. They attributed that to anxiety and stress. And then after going through like several doctors, he somehow ended up in my clinic as a referral. And when I did the testing, it was not normal. He had a condition called myocarditis. Myocarditis is a very serious condition, actually, and it is inflammation of the heart muscle itself. And it is something we're seeing with COVID. COVID is causing inflammation of the heart muscle, and it can cause heart function to diminish, which is heart failure. So it can lead to that. Because of the inflammation, sometimes the heart pump just is not able to work properly. So we can see a reduction of heart function. But moreover, we can see some arrhythmias as a result of myocarditis. If it's not treated properly, these people can go into something called ventricular arrhythmia. There are different types of ventricular arrhythmia, but most particularly is ventricular tachycardia, which is a very erratic rhythm of the heart. And if it lasts long enough, that person can have cardiac arrest, similar to Damar Hamlin. I don't know what his cause was, but it could have ended up in a cardiac arrest. So we really have to be careful as frontline providers, as well as the patients themselves. I think these awareness, education, public education is very important.
Now, this is the hot button question. Are these people vaccinated or are they not vaccinated when they're recovering from COVID and having these types of conditions? And does that play a factor?
I think it does, actually. We will certainly need more data. COVID is still a fairly new thing. We still have a lot to learn from it. And it has evolved, from the beginning of the pandemic till now. At the beginning and in the middle of the pandemic, majority of the people were not vaccinated when we're seeing these conditions. But now a lot of them are, and they're still having some of these heart conditions that I'm describing, like arrhythmia and things like that. But I think overall, from the statistics we do have, people who have been vaccinated are at lesser risk of having that profound disease from COVID, and as a result, less complications related to COVID. Whether it's preventing any of the heart conditions as a result of the vaccination or not, that I don't know. We need definitely more studies on that.
There were also studies early in the vaccination period that there were supposedly a direct link between the vaccine itself and myocarditis showing up in younger people.
There were, and I actually did a couple of news conferences on that. But when you do a comparison of the vaccine itself and the virus and the infection, the scale, the rate of myocarditis related to the virus itself is much higher than the vaccine. It's actually rare. The number, we have had some cases where we've seen myocarditis as a result of the vaccine, but that number is actually on the rare side. And on that note, I will say, other types of vaccines can cause myocarditis as well. So it's not just something unique to COVID-19.
Very interesting. That is Dr. Fahmi Farah on today's Ask the Expert, the head of Bentley Health. Thank you so much for your time and sharing the latest information on this study.